Hello, friends. I am Dr. Ashesh Gala here, uh, practicing eye surgeon from Mulund, West, Mumbai. Today, I will be discussing with you something about the most commonest disease affecting the eye, which is cataract. Uh, Friends, cataract is nowadays very common disease. जो उसमें होता ये है कि हम सबकी आंख में एक ट्रांसपेरेंट लेंस होता है, जो हमारे बर्थ से होता है। और उस लेंस का एक फंक्शन है कि वो जो लाइट बाहर से आ रही है उसे वो अंदर जो हमारे पर्दा है, जिसे हम कहते हैं रेटिना, उस पर फोकस करता है। थ्रू आउट द लाइफ वो जो लेंस है ट्रांसपेरेंट रहता है। हम जब कहते हैं कि किसी को कैटरेक्ट आया है या मोतिया हुआ है, उसका मतलब ये है कि जो लेंस की ट्रांसपेरेंसी है वो खो गई है और वो लेंस अब ओपेक हो रहा है। तो लाइट रेज हैं वो अब भी जा रहे हैं अंदर, मगर बिकॉज ऑफ लॉस ऑफ ट्रांसपेरेंसी जो फोकसिंग पावर है वो चला जाता है। तो किसी आदमी को दिखता है अब भी है, मगर धुंधला, शार्पनेस चली जाती है। ये होल प्रोसेस को कहते हैं कि किसी को कैटरैक्ट हुआ है या मोतिया आया है। सो फॉर्चुनेटली कैटरैक्ट एक ऐसी बीमारी है कि जहाँ पे पेशेंट इज द फर्स्ट पर्सन टू नो अबाउट इट। कैटरैक्ट में सिम्टम एक ही होता है कि पेशेंट का विजन कम हो जाता है ग्रेजुअली। पेशेंट अपने रूटीन एक्टिविटीज़ जो है उसे करने में उन्हें दिक्कत होती है। तो ये पेशेंट कई बार पूछते हैं कि डॉक्टर, हमें कैसे पता चलेगा कि मुझे कैटरैक्ट हुआ है? क्या मुझे कोई सिम्टम होंगे जैसे आँख लाल होना, पानी आना? तब मैं उन्हें कहता हूँ कि कैटरैक्ट में एक्सेप्ट कम दिखना कभी कोई और सिम्टम नहीं होगा। बाकी अनलेस कि कैटरैक्ट इतना पक गया है कि वो पक के अगर ग्लॉकोमा होता है कैटरैक्ट की वजह से, तो ये परेशानियाँ होती हैं। यहाँ पे आँख लाल होती है, हेडेक होता है, वॉमिटिंग होती है। मगर आजकल हम सब बहुत सारे अवेयर हैं, इसलिए हम जनरली डॉक्टर दिखाते हैं और कैटरैक्ट इतना लेट स्टेज तक पहुँचता नहीं है। तो इसलिए कैटरैक्ट में सिम्टम एक ही होता है कि पेशेंट को कम दिखता है। जनरल ट्रेंड ये है कि पेशेंट अपने आँख चेकअप के लिए या तो दे गो टू द आई सर्जन या फिर वो जाते हैं ऑप्टिशियन के पास चश्मा निकालने के लिए। अगर वो डॉक्टर के पास जाते हैं तो उनका डायग्नोज तभी हो जाता है कि उन्हें कैटरैक्ट है। अगर वो ऑप्टिशियन के पास जाते हैं तब ये होता है द रूटीन द ट्रेंड इज कि पेशेंट्स के नंबर स्टेबल नहीं होते और बेस्ट पॉसिबल नंबर के बाद भी पेशेंट का विजन इज नॉट 100%। इन दैट सिनेरियो उनके ऑप्टिशियन उन्हें खुद एडवाइस करते हैं कि आपके नंबर्स आपको सूट नहीं कर रहे हैं, आपका विजन इंप्रूव नहीं हो रहा, तो प्लीज गो टू योर आई डॉक्टर, गेट इट चेक्ड एंड देन वॉट एवर नंबर द डॉक्टर प्रिस्क्राइब्स वी विल गिव इट टू यू। तब इन स्टेज में पेशेंट डॉक्टर के पास आते हैं एंड देन वी कम टू नो कि द रीजन कि उनको नहीं दिख रहा या उन्हें नंबर सूट नहीं हो रहा इज बिकॉज ऑफ कैटरैक्ट। तो तब वो डायग्नोस होता है। वंस कैटरैक्ट डायग्नोस हो गया, द नेक्स्ट स्टेप इज सर्जरी। अनफॉर्चुनेटली कैटरैक्ट में अपार्ट फ्रॉम सर्जरी देयर इज नो ट्रीटमेंट। ना कोई चश्मे का नंबर, ना कोई दवाई, ना कोई मेडिसिन, कुछ भी नहीं है जिससे हम कैटरैक्ट की बढ़ने की स्पीड को स्लो या फास्ट कर पाए या किसी भी चीज़ से हम कैटरैक्ट को ऑल टुगेदर अवॉइड कर पाए। बस ये है कि सर्जरी इज द ओनली आंसर। द ओनली थिंग वी हैव इन हैंड कि सर्जरी कब करना है, दैट वी कैन डिसाइड depending on the stage of cataract and depending on the patient's schedule. Surgery is the only option with which patient can be treated for cataract. Cataract is normally कोई भी बीमारी होती है उसके लिए वी हैव टू modes of treatment, either by medicines or by surgery, depending on the stage of the illness. Cataract is one illness जहाँ पे medicine has got no role to play. Surgery is the only answer for that. Technology is evolved so much कि for the patient it might be routine surgery, but believe me, for an eye surgeon there is nothing like routine surgery. Every surgery by itself is to be taken with utmost care, requires equal amount of skill, technicalities, and professionalism. द प्रिंसिपल बिहाइंड द सर्जरी है कि हम जो हमारा जो नेचुरल लेंस है जो पहले ट्रांसपेरेंट था वो ओपेक हो गया है या ओपेक हो रहा है, उसे हम रिप्लेस करते हैं बाय मीन्स ऑफ अ आर्टिफिशियल लेंस. सो व्हाट वी डू प्रेजेंटली इन द प्रेजेंट एरा कि हम जो हमारा जो कॉर्निया है उसमें एक स्मॉल कट करते हैं विच इज सॉर्ट ऑफ अ वाल्वुलर सेल्फ हीलिंग कट जहाँ पे टाके नहीं आते. उस कट से हम उस कट से वी गो इनसाइड विद अल्ट्रासोनिक मशीन जहाँ पे वी प्रोड्यूस अल्ट्रासोनिक वेव्स एंड हम कैटरेक्ट को बारीक बारीक पीस में हम तोड़ते हैं. तोड़ करके उसी मशीन से विथ हाई वैक्यूम विथ कंट्रोल्ड हाई वैक्यूम हम कैटरेक्ट को सक कर लेते हैं. और फिर जब वो जिस सपोर्ट पे कैटरेक्ट था, जिस पॉइंट पे कैटरेक्ट था नेचुरली, उसी पॉइंट पे वी गो इनसाइड विथ अ फोल्डेबल लेंस. बिकॉज ये कट छोटा है तो लेंस को हम फोल्ड करते हैं, हम अंदर उसी जगह पे रखते हैं, उसे अनफोल्ड करते हैं, उसे हम अलाइन करते हैं इन द बेस्ट पॉसिबल नेचुरल प्लेस एंड दैट्स इट. दैट्स द प्रोसीजर फॉर द कैटरेक्ट सर्जरी. Cataract is one painless surgery. There are two ways we perform. एक है the traditional way जहाँ पे we would give injection below the eye and जो पूरी आँख थी used to be completely numb and patient could not move the eyes. In that way we would do the surgical part and उसके बाद बिकॉज हमने आँख को ब्लॉक दिया है, हम आँख को एक दिन के लिए हम ड्रेसिंग रखते हैं और नेक्स्ट डे हम ड्रेसिंग निकाल लेते हैं. द सेकेंड वे आई वुड नॉट से मॉडर्न वे बट सेकेंड वे इज जहाँ पे हम इंजेक्शन न देते हुए हम ड्रॉप्स देते हैं जिससे आंखें नम हो जाती है बट मूवमेंट रहती है आंखों की. एंड एज पर द सर्जन इंस्ट्रक्शंस पेशेंट्स को आंख खुली रख के एक लाइट को देखते रहना है एंड वी ऑपरेट द प्रोसीजर. एंड उसके बाद बिकॉज आंख नम है येट मूवमेंट्स चालू हैं तो इस समय हम आंखों को ड्रेसिंग नहीं रखते हैं. वी गिव वाइट ग्लासेस टू द पेशेंट इमीडिएटली एंड पेशेंट कैन वॉक बैक होम इमीडिएटली. जो हमारा जब कैटरेक्ट होना शुरू होता है हमारा ब्रेन स्टार्ट्स एडजस्टिंग टू इटसेल्फ कि हमें थोड़ा कम दिखाना शुरू होता है. तो ब्रेन हमारा जो है वो एक्सेप्ट करता है कि हमें इतना कम दिख रहा है, यही दुनिया है, यही वर्ल्ड है. सो पेशेंट इस फेज में रहते हैं जहाँ पे इनको कम दिख रहा है, वो एडजस्ट करते हैं एंड दे अननोइंगली और नोइंगली वो 3-4 months निकाल देते हैं बिफोर बीइंग डायग्नोस्ड और बिफोर बीइंग अंडरगोइंग सर्जरी. जब सर्जरी हो जाती है हम कैटरेक्ट निकाल लेते हैं और वी पुट अ आर्टिफिशियल लेंस. नेक्स्ट डे मोस्ट ऑफ देम कम बैक सेइंग डॉक्टर मैं भूल गया था कि मुझे कितना क्लियर दिखता था. नाउ द वर्ल्ड इज नॉट जस्ट much clear, it is more bright, the colors appear much more natural. जिसे मैं आज तक वाइट समझ रहा था मुझे अब दिखता है कि वो येलोइश था और वाइट क्या होता है वो मैं आज फिर से देख पा रहा हूँ. Colors have become much brighter, things have become much more sharper. It's like a whole new world for me. And this, they experience it almost immediately next day. That usually हम पेशेंट को सर्जरी के लिए सुबह 9 बजे बुलाते हैं. द ट्रेंड इज हम 9 बजे बुलाते हैं पेशेंट को एंड वी स्टार्ट द सर्जरी. टिपिकली एक सर्जरी को टेक्स अराउंड 15 से 20 मिनट. उसके बाद इन द रिकवरी रूम पेशेंट को 10 मिनट तक आराम करना होता है. बाय दैट टाइम आवर स्टाफ एक्सप्लेन्स टू द पेशेंट रिलेटिव कि जो ड्रॉप्स डालने होते हैं, आई ड्रॉप्स, वो किस फ्रिक्वेंसी में डालना है एंड कुछ टैबलेट अगर देनी है तो वो कैसे देनी है, और जो डू एंड डोंट्स होते हैं पोस्ट सर्जरी वो एक्सप्लेन करते हैं. तब तक पेशेंट भी 10 मिनट तक आराम करने के बाद वंस जो एनेस्थेटिस्ट होते हैं वो अगेन मॉनिटर करते हैं पेशेंट के वेल बीइंग. वंस पेशेंट इज fit and comfortable, then we discharge the patient. So ये whole procedure typically takes around 45 minutes to 1 hour, right from the time patient enters the hospital till the patient leaves the hospital. Post surgery, there are few precautions. One is patient can take bath below the neck. He or she has to take bath after head bath after 1 week only. And they should avoid working near the flame in the kitchen for 1 week. Apart from that, by and large, there are no restrictions. They can almost immediately start watching TV. They can talk on the phone. Depending on the type of lens which they have used, if it's a monofocal lens, then yes, then they would require numbers for reading purpose, so they should avoid reading for around 10 days. If it's a multifocal lens, they can start reading from maybe third or fourth day, but the distance vision improves gradually within 24 hours, so the other activities they can do. One precaution we always suggest is they should wear protective glasses for 1 week of time, because we don't want them to have infection in the eye in the first week of recovery period. Surgery procedure has changed drastically in the past. Not many years back. In the past, uh, as less as 25 years back, when I was doing my post graduation, when I was studying, typically हम पेशेंट को आफ्टर सर्जरी के बाद we used to admit the patient for 5 days in the ward. We used to do the dressing, change the dressing for 5 days, and after that we used to instruct the patient to be in dark for at least 2 to 3 weeks. Patient, because we used to take stitches, patient had restrictions not to lift heavy weights, not to take head bath, not to venture outside of the house for 1 month. आज I am confident that अगर my wound has healed properly, patient can literally go out go out of the house after 3 days. Of course, with wearing the protective glass, they can watch TV from the next day. They can do restrictions हैं, आज भी है, मगर they have reduced from 1 month to 1 week. So one more thing is complications. Complication rate has reduced drastically. Not to say that complication नहीं होते, but thanks to technology advancement and the skills developed by surgeons, the rate of complications has reduced drastically. And in an unfortunate event, a complication अगर होते भी हैं, so there are ways to treat them, and eventually patient does get that much vision back. He or she can function his routine life without being dependent on anybody. So that's a major difference which has happened of late. We have to keep on upgrading ourselves. We attend conferences. We do attend workshops where we learn to operate on new technologies on model eyes, on animal eyes, and even on simulated programs before getting the equipments to be operated on our patients. So we undergo vigorous trainings, and this we update very frequently because upgradation is the key to progress. So we do that on a very routine basis. I remember when I was studying, we used to make the cut in the eye typically of around 15 to 18 millimeters of length, wherein we used to take stitches to close the eye. Now the machines we use, which produce ultrasonic waves, उसमें जो कट होता है is just maximum around 3 millimeters. So that is thanks to technology, wherein we have different machines called phacoemulsifier. They produce energy and they are very efficient. And of course, we in the past we used to do eye we used to do what we call naked eye surgery. Now, with the help of microscope, we can see eye as magnification as high as 25x. I mean, for a normal person, maybe 2 millimeters would not make a huge difference. For us, the cut which we make, the incision which we make, is just 2 millimeters. So here, precision is very important, and that is possible only through the microscopes and machines available, which improves our visibility and delivery of technology. Again, in the past, what happens is every eye, human eye, has some power. जैसे if I don't have any glasses, so the power of my eye would be around 60 diopters, of which 44 diopters, 40 diopters would be because of my cornea, and 20 diopters would be because of the lens जो मेरी आँख में है. So when the lens becomes cataractous या becomes opaque, उसे हम निकालते हैं. जैसे ही हम लेंस निकालते हैं, the number of my eye decreases by 20 diopters. इन द पास्ट जब लेंस नहीं थे, हम पेशेंट को टिपिकली +10 +11 नंबर के ग्लासेस देते थे, जो दे यूज्ड टू वी यूज्ड टू कॉल देम soda bottle glasses. They used to be very thick, so patient used to wear them and they could still see, but the vision was not natural in terms of quantity and quality. So then technology revolution happened and lenses were introduced. So the first lenses which were introduced were rigid lenses, hard lenses, and monofocal lenses, wherein once we would take the measurement for the lens for each patient as per his or her eye, calculate that and put that lens only. So the number which we would give to the patient for specs reduced from 10 to 11 to just half a number or one number for distance, and by default they would get if it's a monofocal lens they would get number for reading which is around 2.5. As time changed, people wanted to get rid of glasses even for reading. So then came, which is what we call multifocal lenses, wherein we take care of the distance and near numbers both. So the patient, if they undergo multifocal lenses implant, 90% of their work they don't require to wear glasses. If it's very minute work for 10%, they might require glasses, but with 90%, if it's a multifocal lenses, they don't require to wear glasses. One more change or uh, modernization, what we say is uh, correction of cross numbers. Uh, what we have seen is almost one third of population has what we call cylindrical power or cross number in their glasses. Okay. So cross number, if they wear, I mean, it gives them very good crystal vision. If they don't wear, they can still see, but the quality of vision is not so good. So if such patient, when they undergo cataract surgery, and when we take measurements, if such patients require the cylindrical power to be corrected, then we use a special lens called as toric lens. The toric lens, if implanted in that patient, uh, corrects the cylindrical aspect, and the vision quality and quantity is much better. In the past, when we used to make a very big large cut, and we used to put a lens inside there, would be typically a monofocal lens, and used to be a hard lens. टेक्नोलॉजी इवॉल्व वर्ल्ड वाइज हमारा जो परसेप्शन था वो इज हाउ डू वी reduce the rate of infection after surgery. Um, it was a globally accepted fact that smaller the cut made in the eye during surgery, lesser the chance of infection and higher the safety. So हम जो कट करते थे around 80 millimeters, we reduced, I mean, technology helped us to reduce the cut to 6 millimeters. Uh, what we call as SICS surgery, small incision cataract surgery. जहाँ पे we used to make a small cut, remove the cataract, and put the same hard monofocal lens inside. Then came a technology called phacoemulsification, जहाँ पे we could go with a machine inside the eye, produce ultrasonic waves, and instead of taking the cataract out, we used to break it into small pieces and suck it through that machine. Now, because हम कैटरेक्ट बाहर निकालते नहीं हैं, वो सक हो जाता है, so जो कट रिक्वायर्ड था reduced from 6 millimeters to just 3 millimeters. So with that came an invention of foldable lenses. जो अभी तक lenses hard थे, rigid थे, अब वो we were using foldable lenses, जहाँ पे we used to fold the lens in a cartridge, put it through the small cut of 3 millimeter, and unfold it inside the eye and place it at the same place जहाँ lens था. As technology evolved, something came up we call as MICS, which is micro incision cataract surgery. यहाँ पे the technology is same, wherein we do the same part, but the incision cut is reduced from 3 millimeters to 2.2 millimeters. So it's an unfortunate accident for the patient. Because at times it can be sight threatening or blinding. Abhi, with modern technologies available and medicines and drugs available, infection can be treated. But all the more, as it is said, prevention is better than cure. We don't want that infection to happen. So we try our best that infection should not happen. So we try and take all the best possible aspects before surgery, during surgery, after surgery. Try all to cover all the bases with which we can prevent and avoid infection, so that the patient doesn't undergo that suffering of infection. Broadly, we classify lenses in two categories. One we call multifocal lenses, second we call monofocal lenses. By monofocal lenses, we advise that patient would be able to carry out his distance activities without glasses, and then they would require glasses to be worn for reading. If this would be possible if they undergo uh, monofocal lens implantation. If they choose to undergo multifocal implantation lens, then patient can have a good distance and near work without the need of glasses. Most of the time. If it's a very small thing, fine print like reading share market prices in newspaper or reading the MRP on a tablet counterfoil, then they would still require glasses. But 90% of their near vision would be taken care of with a multifocal lenses. So the decision to which lens would be better is two-way. One is medically, second is patient point of view. Uh, to implant a multifocal lens, the first criteria is the eye undergoing surgery at that point of time should not have any other illness apart from cataract, because the multifocal lenses perform best when eye is otherwise healthy. So before choosing the lens for the patient undergoes a series of tests. वहाँ पे we take the lens measurements, we scan the retina of the patient, we scan the nerve of the patient, we check for dryness for the patient's eye, and once the eye is found to be fit, I mean the eye is found to be normal, then the next step would be to evaluate the patient's lifestyle, because if a patient nowadays we all are spending more time on gadgets, we all have more of screen time, and in the past there would be two categories of work. One is distance, other is near. Now we have something we call as intermediate work. By intermediate, typically near work involves work which is at around 1 feet, which would include reading, writing, which would include mobile usage. But nowadays, as I said, we have more of intermediate work, which is typically at a distance of 2 feet. That includes work like working on a desktop or a laptop, uh, seeing dashboard while driving a four-wheeler, for females working against tawa or gas against intermediate work. So post-COVID, we are seeing surge in increase in our time spent for intermediate. So to combat that, we have. I mean, if a patient chooses, just like in glasses, we have two varieties: bifocal and progressive. In lenses, we have two varieties: multifocal and monofocal. So patients who are active on gadgets and have healthy eye can definitely a candidate for implantation of multifocal lenses. Cataract, the cause for cataract to happen primarily is aging. Uh, as we age from 20 to 40, 40 to 60, our body ages in every part. Our skin becomes wrinkled, people uh, lose hair or the hair becomes white. Same way, our ages. As a part of aging of the eye, the lens, which was clear all these years, now starts losing its transparency and becomes opaque, which is called cataract. So, aging is first commonest reason for cataract to happen. Second commonest reason for cataract to happen is typically illness, especially the most common lifestyle illness is diabetes. Whenever we get, uh, whenever our blood sugar increases, the nutritional aspect of the cataract changes, and we tend to get diabetes at a very early age. Patient who are diabetic have a very high chance of getting cataract at an early age. Sometimes third common cause is side effects of medicine. Like if a patient has asthma and if he or she needs to take pumps or inhalers, especially steroids, then definitely they have a chance of getting cataract faster. If a patient has skin illnesses like psoriasis or eczema, wherein they have to use steroid ointment, they have a high chance of getting cataract at early age. So yes, some medication side effects uh, are a cause of cataract. Sometimes any injury or any accident can also cause what we call traumatic cataract. So these are the few common causes for cataract to happen to anybody. Uh, Cataract comes with its own series of myths and misconceptions. The commonest being in the past was operation should be done only when the cataract is ripe. That was to an extent true in the past. Now we don't wait for the cataract to ripen because as cataract ripens, more the chances of cataract bursting and causing complication called glaucoma. So we don't wait for the cataract to ripen. We all are active more nowadays. The more cataract advances, the more patient will have difficulty in their activity, and the earlier you operate, the earlier better. Then second misconception should be about the recovery period. Would be on the about the recovery period that typically patient have in mind given scattered is there, he or she cannot move out of the house for a week. They should lock themselves in the room for a week. We tell them that you can move around with the glasses on almost immediately after third or fourth day, and they can definitely watch TV from the next day. So, because thanks to technology, the recovery is very fast, and they can almost have natural vision almost immediately. Then other myths and conceptions. Is there any medication for cataract? There are tall claims by different branches of medicine, non-allopathic, where they claim to reverse cataract, and then patients ask us to prescribe the medicine for cataract, which where we have to explain to them that no medicine works for cataract. Surgery is the only cure for cataract. So I remember a case of uh, 3-year-old child who was brought to me by the parents that he is not able to connect with is not able to the child is not he's struggling in his daily activity, and he's not able to grasp things when given to him. So when I examined, he had cataract in both the eyes, and I advised surgery for the child after due medical fitness from the pediatrician, and eventually the child underwent surgery by me, and I cannot forget the happiness on the mother's face when she came for follow-up. After repeated follow-up, at the final follow-up for 3 months, she her words were, "Doctor, I can now I can understand my child is able to see me." So that the joy which she had was I cannot describe. The patient undergoes a cataract surgery. The next day when they come to me, typically most of them are very happy, and they say in their words that now we are seeing things much more brighter, much more sharper, and we are able to see true colors. I mean, what we thought colors were, we know now it's not. The colors are now something really different. And if a patient has cataract in both the eyes, now patient is convinced that what his real vision is with the operated eye, the patient immediately takes a decision to undergo surgery in the second eye within 4 to 5 days. So that's a big shift in the patient's approach. In the past, patient would wait for this eye to heal completely, which would be typically 1 to 3 months, and then decide about second eye. Now patient know कि now how better I can see, how natural I can see, and how fast I can see better. So hence everyone wants to see second eye also with the second eye also equally better. So they most of the time when they come for the next day, immediately they take date for the second eye in 4 to 5 days. Friends, I would like to end this with a message that cataract is the number one reversible cause of blindness globally. Thankfully, it is reversible, meaning moment to remove the cataract, whatever vision patient has lost can be regained completely, and it is still it is a leading cause. So let us make an effort to bring the numbers to as low as possible. Get your eyes checkup done of your elderly relatives to your eye surgeon. If they have cataract, don't hesitate. Get it operated at the earliest because the natural vision which God has given us is truly it's a priceless gift which we have got, and let us enjoy it the most. Thank you.